Good afternoon. Welcome to the Living with ALS webinar series. I am Lori McFerrin with the ALS Association. Thank you for joining us today. I want to share some helpful hints for those who haven't joined us before we get started with Katie and Claire. We will save at least 10 or 15 minutes at the end for questions and discussion. Feel free to enter your questions and comments into the chat or into the Q&A at any time during the presentation. Even though we won't stop for questions until the end, we want you to take all the time you need to get your questions in there. And if asking your questions aloud is easier, during the Q&A, please use the raise hand function within Zoom at the bottom of your screen. Once we see your hand is raised, we will ask Tamara to open your mic for you. Before I pass things over to Claire and Katie, I want to ask that you provide your feedback by completing the 3-question survey at the end of our webinar. This is where we gather ideas for future educational programs. So the reason why you're here, let me introduce Claire and Katie. They've joined us from the Healy and AMG Center for ALS at Massachusetts General Hospital. Katie and Claire, thanks for being here today.
All right, thank you. I'm gonna, of course, my slide is not moving, so just a minute. There we go. I'm gonna start with a quick agenda of what we would like to go through today. Thank you everyone for joining us. We're very excited to share this information with you. We're going to start with very brief introductions so you know who we are as we're talking with you, and then briefly go through a little bit of history of how far we've come in terms of exercise and exercise guidelines for people living with ALS, and then we'll dive right into some of the guidelines. We did want to take some time to focus on fatigue management, and then Claire and I came up with some frequently asked questions that we get asked a lot in the clinic, and we figured we'd start with those questions and then share our take-home messages before hopefully having enough time for all of your questions. So I am Katie Burke, and I am a physical therapist. I've been at the Healy Center now. I'm in my 8th year, and before that, I did acute care for many years. And I am honored to be here with my colleague, Claire, who I consider both a friend and a mentor, and I will let Claire introduce herself and get us going on this.
Hello, everybody. Thanks so much for joining us, and thank you for the kind words, Katie. I consider you a mentor, so right back at you. Claire McAdam. I've been practicing as a physical therapist for about 42 years. The past 20 primarily have been working with individuals with ALS. I'm currently also here at the Healy Center for ALS at Massachusetts General Hospital. Prior to moving to Boston a few years ago, I was the ALS Center Coordinator at Baylor College of Medicine in Houston, Texas for about 14 years. But as Katie said, very pleased to have you join us today, and I'm excited about the information that we'd like to share with you. I'm going to start by giving a little bit of a historical perspective because things have changed over the years, and we think that's actually some of the exciting news. Years ago, 10, 20 years ago, a lot of individuals diagnosed with ALS heard things like be sedentary, don't exercise, don't be active, sometimes even put yourself to bed. There was concern that exercise or activity may aggravate the condition, may accelerate the progression. Now we actually know just the opposite. We know that the body craves motion, needs activity, responds well to it. So there's so many benefits to exercise that individuals with ALS can benefit from. We also know that just being sedentary can actually create its own problems. Circulation doesn't flow as well. Joints get stiff, muscles get tight, digestion slows down. We just sort of get a general sense of achiness. So we know that there's so many benefits that can come with exercise and activity and movement. What we're eager to share with you today is there are some general guidelines that we encourage folks to follow. Some of this is based on research. Some of this is based on lived experiences from patients and caregivers and therapists, just information we've learned over the years. But we're eager to share sort of a balance of information with you today, opportunities for exercise, but also some guidelines to follow. We do want everybody to know and appreciate and respect the fact that exercise and activity is a very individualized approach. We won't be sharing just a straight old exercise program with everybody today, because it does really need to be individualized to the person. Prior exercise experience can play a significant role in what a person does once they've been diagnosed with ALS. Some folks may have been relatively sedentary prior to the diagnosis. Others may have been quite active, maybe even possibly athletes. And so that will dictate a lot about how an exercise program would be designed for that person. Respiratory status can certainly have a big impact. We do know that the muscles of respiration over time can be affected by ALS. And so if an individual is having some challenges with the breathing muscles, that's certainly going to impact how we design an exercise program for that person. I'm going to jump over to nutritional status because that kind of goes similarly with respiratory status. Many times individuals are told, you know, take in as many calories as you can. It feeds the muscles, it feeds the body. Let's do as much as we can to avoid malnourishment. So if an individual is struggling to get in enough calories, we don't want to prescribe an exercise program that it would end up burning more calories than the individual is able to take in. At the least, we want to find a balance. So that can certainly impact the prescribed exercise program. Life obligations, individuals who are working, who have just busy days as it is, that their exercise program is probably going to look a little different than somebody who maybe has a little bit more time during their day. And then lastly, just current functional status. An individual who may be fairly newly diagnosed and functioning at a high level may have an exercise routine that looks very different than somebody who has had ALS for a few years and their abilities have changed. So just the general thoughts and guidelines, and we do know our bodies crave and they benefit from movement, so we want to give that to our bodies. We do know with ALS the muscles are struggling and going through changes, so we want to make sure that what we give the body is appropriate for what the muscles are able to do. You'll hear these next items a few more times during our presentation today. Can we offer the muscles gentle activity without overstressing them? Is that key to kind of finding that ideal balance. General consensus is avoid muscle soreness. So avoid pushing yourself so hard that your muscles are sore after a routine. Avoid a sense of overexertion. It may just be that we've just pushed the body too hard and we've gone a little bit too far. Avoid a sense of excessive fatigue. And we'll elaborate a lot on fatigue a little bit later in the presentation. And then also the general consensus seems to be if you've worked on an exercise routine, if you've done some walking, if you've been on a stationary bike, if you've done some light resistance training, generally you want to feel like you've recovered from that activity within about 30 to 60 minutes. If you find that you're still feeling it, either shortness of breath, exhaustion, sore muscles, hours later or even the next day, that is the body's way of saying that was probably too much.
Okay, so what do we mean when we say exercise? It can really mean so many different things. And for the purposes of this presentation, we've chosen these categories to focus on. So stretching, aerobic activities, your cardio, resistance training, balance, and then functional activities. And you might notice that we we left out respiratory exercises, and Claire and I discussed this, and we actually think that respiratory exercises that topic deserves a webinar to itself. So maybe we can talk with Lori and get that on the calendar for another topic. So for this, we're going to go through these 5 topics, and we have 2 slides dedicated to each category. And we've set it up where we'll start by discussing the benefits and then go into some of the general guidelines for each of them. And you'll notice on the slides later that we have incorporated some references, and the reference list will be at the end. So we start with stretching. Stretching is muscle lengthening, range of motion exercises, really to maintain joint integrity and maintain the range of motion at your joints. It can help to prevent contractures where you end up losing range of motion, and those contractures can end up being quite painful. We do see them most commonly probably in hands and ankles, but shoulders can also get very tight. Your hips and knees can get quite tight as well. So kind of a full stretching program is recommended to help maintain the range of motion throughout. And really, stretching can help with muscle relaxation. If you're moving slowly in and out and allowing yourself to breathe, you give those muscles time to relax and stretch out, which can aid in pain management and really can help make your activities of daily living or your ADLs easier. If you have very tight shoulders, for example, it can make dressing, upper body dressing, quite difficult. Getting on shirts or jackets with restricted shoulder range of motion is not only challenging, but can be very painful. So we recommend stretching for pretty much everyone, as long as it's well tolerated. And some general guidelines that we have here is daily stretching is ideal. Really, everyone or almost everyone, myself included, should be stretching daily. And to get muscle lengthening, you really want to hold those stretches for about 30 to 60 seconds. Some people might benefit from longer. So again, it is individualized, and you should talk with your clinical team about what would be best for you, but you should be able to breathe throughout, be relaxed. It should not be painful. You should not be pushing through the pain. This is not one of those situations where it's no pain, no gain. It really should be a comfortable stretch within your available range of motion. And if that's not full range of motion, if it is limited, just go as far as you feel comfortable, hold it there, and hopefully with more stretching, you actually end up gaining more range of motion over time, but it can definitely take time. And this really can be done independently or with assistance. And I think the key, if you're having someone else help with stretching, is that they too move your limbs slowly in and out of the positions, and that you have a way of telling them either verbally, or if you're not able to verbally, you have some other cue of telling them if it's too much or if they can push a little bit further. So you do need some sort of system to communicate how it's going so that it's not painful. And I just want to draw your attention to the star with the relevant research. That's where we've put in some of our references there in case you want to take a look at them at the end. When we talk about cardio, aerobic training, this is more of that continuous motion for cardiovascular health. So it can be the stationary bike, for some people walking, some people it's swimming. We do have people who are running, and it can help enhance muscle endurance. It can help regulate blood sugar levels for anyone, not just people living with ALS, and increase blood flow to your brain and your extremities. It can also help promote emotional well-being, because it can release some of those endorphins. So sometimes just having some cardio can help with your mood. And if you are able to do weight-bearing activities, this can help with bone density. I think when people think of cardio, they think of more the walking and running and jogging, but you can get quite creative with the cardio work. So it's, again, good to talk with your team about it. The guidelines we have here are to choose a safe mode, choose something that you feel comfortable doing, that you're not likely to get injured doing, that you can tolerate with your respiratory status and everything else that you have going on, and also that you enjoy doing. I've had a lot of people ask me about aquatic therapy, which I personally think is great, and I think a lot of us think it's great, but it's not great for someone who doesn't like getting in the water. So I would recommend that person choose something else. And again, you can talk with your clinical team about what you enjoy doing, and hopefully they can figure out a mode that works for you. But you do want to monitor your breathing throughout. As Claire mentioned, the respiratory status plays a big part here. And if you're straining your respiratory muscles quite a bit with the aerobic exercise, then that may be a reason to either do less or take this part out. If you are starting it, you do want to start easy and for shorter durations. So you might even just start with 5 minutes or 3 minutes on a stationary bike and see how you do with that before gradually building it up. Some people come to us though, and they're already biking 20 miles. They're athletes, and that's someone who, again, we recommend that they listen to their bodies, see how they're tolerating it, listen to their breathing, and make sure that they're recovering within that 30 to 60 minutes that Claire had mentioned. It really shouldn't be harder than moderate intensity, that 50 to 70% effort. And there are different ways to monitor this. You can use a heart rate monitor. You can use a rating scale, as we have up in the corner there, to help you figure out the appropriate level. I am definitely biased as a PT, but I do recommend working with a PT to figure out where this moderate intensity is for you and how it might change over time. A lot of people ask, how many minutes should I do? And the answer to that is different for everyone. If you are tolerating your program and feel like you can do quite a bit of this aerobic training, the American Heart Association does recommend at least 150 minutes of moderate intensity exercise per week for adults to get the cardiovascular benefits. So I don't think you need to go well beyond that. But if that is too much, you can definitely do less, and even 5 minutes can be better than nothing. I've also found a lot of people who have told me that sometimes they'll tolerate several short sessions throughout the day rather than one long session. So they might do 3 10-minute sessions rather than a 30-minute session, because the 30 minutes will knock them out for the day. But the 10 minutes, they're able to recover pretty quickly and still do everything throughout the rest of their day. I do acknowledge that that can be difficult to fit into a day if you are busy with other life obligations. So again, you have to talk with your team to figure out how this might work best for you. We move to resistance training. This we're intentionally not calling strengthening. It is resistance training, and there may or may not be strengthening with it, but the benefits are to hopefully maintain strength in muscles that are not affected by the disease, keep your stronger muscles gently exercised, and really to avoid disuse weakness. If any of us were to sit around and do nothing, we would get weaker, and we don't want people to get weaker from not doing things. So hopefully by doing some amount of activity, which may not necessarily be resistance training, we're able to avoid this disuse weakness, even though we know that there will be weakness coming from disease progression. The resistance training also has the potential to make daily activities easier, making it, again, by keeping those muscles stronger. So the guidelines here, these Claire had mentioned earlier, but really avoid that muscle soreness. And sometimes that soreness can come a few days later. So you do want to give yourself time to recover and figure out how your body responded, especially if you're starting a new program. But ideally, you would recover within that 30 to 60 minutes. You want to avoid a sense of muscle fatigue and overexertion. If you're tired while you're doing any of these exercises, that actually is pretty normal. It's okay to be tired while you're exercising. It means you're working, but the key is that recovery after. And if you're recovering within a few minutes, if you're recovering within that 30 minutes, then you're probably doing okay, especially if you can do everything else that you want to do throughout your day. So again, if you are new to resistance training, start with low weights, low number of repetitions, maybe 2 times 5 reps or 1 set of 10 reps. And again, work with the PT or an OT to help with this, and focus on correct form throughout all of the repetition. It's, if you are losing your form, you are likely to get injured, even if it's just, it could be a simple muscle strain, but even that can put you back and impact your function. So you want to make sure you have good form, and again, focus on your stronger muscles that may not be impacted by the disease.
So balance training is another form of exercise, and oftentimes when individuals are participating in an outpatient PT or OT program or home-based therapy, the therapist will provide some balance exercises or some balance training, typically done either in the seated or the standing position. The idea behind this is there an opportunity to gently train or gently work muscles that help us when we balance, so that when I'm seated on the side of the bed and putting on a blouse, I have a little bit more control, or leaning forward to maybe slip on my shoes, I have a little bit more control. Balance exercises or training in the standing position oftentimes is from a focus or addressing, can I make my walking a little bit safer, a little bit more secure? And also, can I work on some balance training to reduce the likelihood of falling? So these types of exercise are oftentimes folded into a formal PT and or OT program in the outpatient setting or in the home setting. For standing exercises, the main guideline is oftentimes we'll say just have something close by to hold on to. Don't necessarily hold something real tightly as you're doing your balance exercises, but it's just so key to be in a safe situation so that you're secure. And if you feel like you're starting to lose your balance, you have a handhold to prevent a fall. Functional activities. This is a way to sort of take the whole theme of exercise and weave it into your day. When I visited with folks in our clinic, sometimes I'll say, I don't want you to feel like you have to walk your dog and then do some of the yard work or gardening you had planned on and then go for your cardio walk. You can definitely think about your day and how can you blend or fold or weave exercise into some of the activities that you already do, partly because you're already doing them, but partly it's also one of the themes of fatigue management. Can I just work some of this in together? So the walk with the dog could certainly meet that cardio need, if you so desire. The things many of us choose to do during the day, depending on how much time we have, are oftentimes the things that also bring us joy and are meaningful. And that can just make an exercise routine even more fun, if you will. Yeah, I think I'm ready for the next slide. So again, I know we sound a little bit like broken records, but doing these functional activities during the day, you want to try and avoid that sense of overexertion. If you can pace yourself, that would certainly make things easier for you to where you can still do what you want to do without feeling too exhausted, and just the sense of trying to avoid excessive fatigue.
So we wanted to incorporate this topic of fatigue because we have many people who come to our clinic and ask this question: why am I so tired? And again, the answer is it depends, and it depends on a lot of things, but there have been studies showing that up to 90% of people with ALS report fatigue as a symptom, and many of those report it as one of the most burdensome or bothersome symptoms. So it's definitely something that we need to be paying attention to, thinking about, and helping to hopefully measure, but also manage. And there are varying presentations of fatigue. For some people, it may be limited to one limb or body system, and for others, it's a full body exhaustion that really wipes them out for the whole day and can limit them from doing even their daily activities. The contributing factors, again, can be many things. Their activity level. So this can vary from people who are more sedentary and are fatigued and may be related to doing not enough activity and movement, to those who are on the far end and doing every amount of exercise that they can, and potentially that is fatiguing them. But then everyone in the middle too, and thinking about what you have to do throughout the day and how much exercise you're adding on top of that. Is it too much? And sometimes it doesn't take a lot to push you to that point of over fatigue. The nutritional status is huge here. I'll sometimes ask people when they say, why am I so tired? Well, how's your weight been? How are you eating? And well, I haven't been eating much at all. I don't want to eat anything. I'm losing weight. And that alone could be the main reason why you are so tired. So figuring out a way to improve their nutritional status and get some weight maintenance can be very important in addressing this fatigue. The respiratory status is another very important piece of this puzzle. And if you are using a lot of energy just to breathe, then chances are adding any additional exercise, especially that cardio or the resistance training, might be too much and may push you into that fatigue. And that's where something like a BiPAP or working with a respiratory therapist and the pulmonologist to help really optimize the respiratory status and support for those muscles can be very important in addressing this big picture of fatigue. Emotional well-being. This is a very broad term, but we all come to the table with varying levels of our emotional well-being, and this can include everything from social supports to different family roles and other life obligations that are requiring some amount of energy. And that may not be physical energy, but it might be emotional energy, and even that can contribute to the fatigue. So acknowledging and talking about all those other stressors, and even if they're not stressors, but just things in your life that require your attention, can help answer this question of why am I so tired? And finally, sleep. Again, I have people come in and they say, why am I so tired? And how are you sleeping? I'm not sleeping at all. If I didn't sleep at all, I would also be very, very tired. So again, working with the team, which can include PT, OT, the neurologist, maybe the pulmonologist, respiratory therapist, to optimize your sleep. Make sure you're comfortable when you're in bed and that you're breathing comfortably when you're in bed, that your mind isn't racing and you're able to actually sleep, can help with this fatigue management piece. So it's quite complex. And we do have some suggestions for fatigue management, but again, it is very, very individualized. But medical equipment can be a piece of this. So whether it's using a walker, not because you need it for balance, but because it'll actually make it easier for you to get from point A to point B, because you won't have to think so much about every single step you're taking. Or so you can bring your BiPAP with you while you're walking. Sometimes that medical equipment can make things easier. A hospital bed is another good example of this. Whether it be a hospital bed or an adjustable bed, can make it easier to get in and out of bed. So you're not using all of your energy just to get in and out of bed, but you're using technology and medical equipment to make those tasks easier. And I think I'll give one more example again, because I'm a PT and talk a lot about equipment. But the wheelchairs, I know that a lot of people don't like jumping in and using a wheelchair right away, but it's just another tool that if it makes one task easier, then you can use it for that one task so that you have energy later during the day to do the things that you enjoy doing and that you want to be doing. So really thinking about what medical equipment can we use to help make things easier, to help conserve energy. And then pacing strategies. And this, we've talked about a little bit, but spreading tasks out. So as Claire was mentioning with the functional activities, is you really can spread things out throughout the day, take rest breaks when needed. You are allowed to take naps as long as you have time to take those naps. But it does take some planning and thinking about what do you want to accomplish in that day or in that week, and how can you set it up so that you can tolerate it. I think it was Amy, one of our other PTs, gives the example of a dollar bill. And if you have a dollar bill to spend throughout the day with your energy, do you want to do it all at once in the morning and then go into debt and work your way out of that energy debt throughout the day? Or can you kind of spend smaller pieces of your dollar throughout the day so that you last longer? Activity modification. This kind of ties into both the medical equipment and even the pacing, but finding ways to modify the tasks that you're doing. Can you sit in the shower? Can you sit to get dressed? Are there different ways to do the tasks that you need to do so that you conserve energy? And then we come back to these three again: sleep, nutrition, and breathing support. They all play very important roles, and really you should talk with the entire team of how to optimize your sleep, how to optimize your nutrition, and make sure you're not losing too much weight and that you're not working too hard to breathe throughout the day. So now we're going to go into some frequently asked questions that we get a lot in the clinic, and we won't spend too much time on these because we definitely want to get to your questions, but we'll start. The first question is, can I exercise? And hopefully we've convinced you that yes, you can exercise, and movement is good for the bodies. So we do encourage you to do some amount of exercise. What exercises should I do? And this brings us back to it depends. And I like to start by finding out what people are already doing and how they're tolerating it, and then adjust from there. And I think about each of those 5 categories that we went through: stretching, aerobic, resistance, balance training, and functional activities, and see if we're hitting each of those, and do we need to be hitting each of those? And that's how I help figure out what exercises to do. But how and where do I start, especially if I haven't been doing anything? And I like to say to start with the range of motion and stretching. It tends to be well tolerated, and really it has good benefits of maintaining joint integrity and can help with pain management. I think the functional activities goes along with that, as I don't want you to stop doing the things that are important. So what functional activities do you need and want to be doing? Can we incorporate some stretching? And then let's go from there and see if it's appropriate to add anything else. The how much should I do depends on your activity tolerance. Again, how much are you doing? How are you feeling? And how can we adjust so that you are getting all the benefits from exercise without overdoing and paying the cost later? So again, the right amount is different for every person. And as long as you are recovering within that 30 to 60 minutes, then what you're doing is probably okay. And whether or not you can add more would be a good question to talk with your clinical team about. Can I work with a PT or an OT on establishing a program? And again, we are very biased here, but yes, yes, we strongly encourage it. And it's a great reason to either go to PT, outpatient, or have them come into the home to really help establish a program that either you can do on your own or with friends or caregivers. And it's good to be connected with a PT who then can check in and kind of do tune-ups as needed. So it may not be a lot of visits to establish a program, but then if anything changes, they can come back out and update that program. So we are advocates of working with PT and OT.
So my friend told me no pain, no gain. Does that apply here? Generally, it does not. Some of the ideas that we think about when we're really pushing hard through exercise and we're thinking, let me at a cellular level kind of break down my muscle so I can build it back up. So sometimes you'll hear no pain, no gain, or feel the burn, or push through the pain or the fatigue or the ache. None of that really applies here. We know with ALS, the message that the nerves are getting to the muscle is challenged. It's not coming through clearly or fully, so the muscles are now struggling. Our thinking is gentle exercise can kind of buoy or support the muscles. Anything that pushes them really hard can just knock them down, knock them back. We don't sense that there's the likelihood of permanent damage. We just find that if an individual pushes themselves too hard with either resistance training or cardio training, it just sets them up for a few days of not feeling great, which is unfortunate and not needed. So we don't encourage some of those phrases that you occasionally hear, say like at the gym or folks who are pushing themselves really hard with exercise. If I just work the muscles, will I help keep them strong? It's a balance. As Katie had mentioned, no activity at all. If muscles are still functioning fairly well, no activity at all can kind of just weaken them because they're not having a chance to work at all, but we don't want to throw too much at them. We find that if a muscle has weakened to a certain extent from ALS, we can't really exercise that strength back. We sort of want to meet the muscle where it is at that moment and support it as best we can. Has my daily activity routine, sometimes referred to as ADLs, activities of daily living, has that become my exercise? Sometimes it does. We've certainly met with folks before that have said, I get up in the morning, I sit on the side of the bed, I go into the bathroom, I wash my face, I come back into the bedroom, a family member assists me putting on some clothes, I walk out to the breakfast table, and I'm kind of tired and I need to sit and rest. In that situation, I would say that, your activities that you're working on to just get yourself through your day, to a certain extent may have become some of your exercise. So I'm always eager for folks to know if doing your daily activities is tiring, don't feel like you have to add a formal exercise program on top of that. Work with your PT, work with your OT, work with your clinic team to find what might be my new routine, knowing that some of my activities of daily living are a significant part of that. And I have a program, but I'm getting more fatigued with it now, where I just can't do it all. Should I modify it? Absolutely. I've had many folks that I've worked with say, the one thing I can expect is change. Sometimes I feel like I'm fairly stable and then something changes and I have to adjust. And an exercise program can certainly be like that. A routine that maybe served you well for several months, if it's now causing a lot of fatigue, if you find that maybe you're losing some weight or you're getting short of breath with the activities, then again, I highly recommend that you work with a PT or OT or your clinic team to adjust that. It doesn't mean that everything has to stop completely, but certainly the program would probably need to be adjusted to meet you where you are at that moment. Is there ever time to stop exercising? Since we consider gentle stretching and range of motion one component or one piece of the pie of one piece of the exercise pie, there's always a place for that. As Katie had mentioned, stretching our joints, stretching our muscles, oftentimes just brings the body comfort. It's good for circulation. It keeps the joints from getting tight. It keeps the muscles at the length that they want to be at. It can even help with digestion and bowel movements, helps a little bit with breathing. So I don't know if I'd ever tell somebody to stop exercising completely, but the exercise routine may come to the point of being some of the daily activities with a gentle stretching program as part of that. So our take-home thoughts. We hope everybody has a sense now that it's okay to exercise. I know we threw a lot of guidelines and some rules, if you will, at you, but hope you have the sense that it's okay to exercise. Certainly an emphasis on safety and activity tolerance. Safety, the falls can be horrific, and falls can really set a person back. A fractured hip, a concussion can really make things problematic for a person with ALS. So we're always harping on safety. And then activity tolerance. The body has amazing ways of sending messages back to us. Shortness of breath, muscle soreness, fatigue, listening to the body and trying to pick up on some of those messages will give you a sense of how you're tolerating a program. Continuous modifications, things change, and an exercise program or routine can and should be adjusted as needed. We've talked a lot about just individualized programs based on how what's going on in the person's life and how things are going for their body at that time. And we talked about team approach. I think Katie and I have both mentioned a couple times, check with your clinical team, talk to your PT, talk to your OT. Also, our families and our caregivers and our loved ones are part of our team. Just talking with them about what you want to do, what you can do, how they can be a part of it. I know some couples that stretch together. I certainly know a lot of folks that walk together, partly because it's joyful, partly because it's meaningful, partly because it's exercise, partly because there's a safety advantage to have when someone walk with you. So your team can certainly be your clinical team, but of course we all know that our teams are our families and our loved ones and our caregivers. And then to reiterate one point, again, the clinical team is the one that can really help you create a day routine, an exercise routine, a week routine that works for you and helps you feel as good as can be. So
I think we're ready for the questions. And again, thank you. But I just wanted to let you know the slides will be posted and we have our references. It's as the last slide. So they are there and there are more. We chose just a few here. So if you're looking for more, let us know.
Thank you, ladies, so much. We have plenty of questions to get to. I see we've got raised hands. We have questions in chat. And so we do have a nice amount of time to get to those. I want to first just say, Richard left us a message from the very beginning that his sound was going in and out. I did get back to him to let him know that Tamara and I weren't able to duplicate that. So hopefully, Richard, you're still out there. And if you've got additional questions, hopefully you're able to hear us. And hopefully, if you have questions, you'll rejoin. So let's start with some of the questions that first came in. So Githa says, it's refreshing what you say about yes to exercise. Therapists at my clinic are alarmed at my exercise routine. I am comfortable with my routine. They say active exercise only 3 times a week. Thoughts?
Do you want to
I
start,
would,
Claire?
and then you chime in.
Yep.
I'd certainly go back to how do I feel? If you're someone who really enjoyed being active and you're working on a routine, whether it's cardio, whether it's resistance activities, if you feel pretty good, maybe a little tired, but pretty good after your routine, and you've recovered within about 30 to 60 minutes. There's no shortness of breath, weight remains stable. I don't see why you couldn't continue.
I agree. And again, it's hard to answer it specifically without meeting you and hearing exactly where you're at and what you're doing. But again, if you're tolerating it and everything else looks good and there are no falls, no safety concerns, then you're probably doing okay.
And it's probably fair to say, you said at the beginning that before people were told to sit still, save your energy, that sort of thing. And so some of that thinking is likely still out there. And so you did share in the slides will be posted at least by next week on our website, if not before. And so those resources can be shared with your therapists, with practitioners. There's some great research available for ALS practitioners. So thank you.
I think I will just add, if you don't mind, Lori.
No, I'd love.
You can overdo it. So you really do need to be honest with yourself and your therapist about that recovery. And I definitely have met people who aim to please their therapist and want to say, yes, I did it all. And yes, I was fine. And then they come in and tell me that, oh my gosh, I couldn't move for 2 days after, but I don't want to tell them because they'll feel bad. And really the therapists need that feedback, because even if you're tolerating their session really well, if you're not recovering well, they do need and should adjust that program. So it's very important to be honest with yourself and your therapist about that recovery piece that we're not seeing when you're with us, and the weight and your respiratory, like all the other pieces of the puzzle play into it. So share all of that.
Yeah, great reminder, and a great reminder that really the multidisciplinary team works together, but they all need the information to help you stay your best. There are some great questions around, is there such a thing as ALS rehab? And along those lines, what would maintenance therapy look like? And is that going to be covered by insurance? Do you know?
It's a great question. Maintenance therapy should be covered. It's a very kind of tricky topic because there are requirements for the maintenance therapy. And again, I mean, I think Claire and I went to a talk that was an hour and a half on maintenance therapy. So it is a very complex topic, but the key components, and Claire, you can definitely chime in. Medicare has said that they will pay for maintenance therapy, but you do need to show that there is a skilled need and that need requires a therapist, PT, OT to do or carry out that program. And it needs to be documented in such a way that it is being labeled maintenance therapy, that the goals are consistent with the maintenance therapy, and that they're really showing that the skilled need is there. And I know range of motion is one that will come back. And if someone in the home can do the program, then it likely won't be covered if they're just coming out for the range of motion. So it's a very fine line, but if it is a true maintenance program, it should be covered. Is there such a thing as rehab in ALS? And I think, and Claire, we have not discussed this much, but I'd love to hear your thoughts. I think with Qalsody, we're getting close for at least some people, and we're definitely starting to think about it, which as a PT, it's a very exciting time to be here, because I think we are, the then that Claire presented was don't do anything. And now we moved to it's okay to do exercise, but we're not going to get you better. And we might be dipping our toes to the point that there might be rehab in the near future, and maybe it's here for Qalsody. I do know there's at least one study looking at that.
And just one additional thought about the skilled maintenance. The catalyst for getting Medicare to revisit that, which was a lawsuit actually, I want to say almost maybe 10, 12 years ago, was just the public coming forward and saying, we understand folks can go to outpatient therapy or receive home-based therapy because they're going to recover from a total knee replacement or a stroke or what have you. But the population of individuals with Parkinson's disease or multiple sclerosis or ALS really advocated strongly to say, we need and deserve therapy. So what my experience has been, I concur with everything Katie said. And what my experience has been is the frequency may be a little different. It may, instead of it just being like 2 or 3 therapy sessions a week, sometimes it may start out frequent, and then the sessions get extended. The thinking being now you come back in, you and the therapist revisit how you're doing, where you are, how things are going, modify your program, and then you work on some things at home and come back. So it's not like it would be 3 times a week of PT indefinitely. There's some less frequent visits that also come with the skilled maintenance approach.
Thank you. So certainly talk with your therapist. Knowledgeable therapists will know what they can bill for. Tamara, I wonder if you can help me. We've got a few folks with raised hands. Let's start with Dan. Oh, we've got 2 Dans. So Dan, Dan Betcher or Dan Wise, if you want to ask your question. Dan
Okay,
Wise.
hello.
Hi.
Well, I went to my center last month and they didn't mention anything about exercising.
Just that you shouldn't.
That I shouldn't, but I have balance issues. So should I start with the balance exercises first?
Have you gone to like an outpatient clinic, or have you had a therapist come to your home and sort of evaluate where you
No.
are right now and how you're doing?
The OT and the PT were at the center.
Sure. Yeah. You can certainly request to, depending on, the ease of you being able to get in and out of your home, you can certainly request a referral to an outpatient PT, an OT, or the potential of having them come to your home to kind of assess where you are at this point. I tend to never say never. At the least, you and maybe some caregivers or loved ones in the home may want to just be on a comfortable stretching program. That's one of the reasons Katie and I wanted to take the word exercise and kind of give out what the subcategories are, because I think sometimes people throw out exercise and everybody immediately thinks dumbbells, leg press, running. And I always feel that there's something, if somebody wants to do something and addressing balance, there's always something that can be done. So I'd maybe call them back up and say, can I visit a PT, outpatient or
Okay.
home-based?
I'll also
Thank you.
add, just for outpatient PT, people in the PT world, we specialize. So there are definitely clinics that are primarily orthopedic, and then there are others that do have therapists who specialize in neuro. And so we try to get people set up with neurotherapists. It's not always possible, and depending on where you live, there are PTs who just see everything because they have to see everything, and they're fantastic in that they can do that. So finding someone who's comfortable with neuro, if you're going to outpatient, would be probably a good starting point. If it's home care, they see everything. So they're geographically based.
So with that being said, do you have a list of neuros in the Hudson Valley of New York?
I would have to look, but maybe if you get in touch with Lori, she can reach out to us and we can see if we know of anyone that you could potentially ask about at your clinic.
Okay, thank
And
you.
it might be worth asking your clinic as well. They'll know the therapists in their area. We know the people around the Boston area pretty well. So I would if you go back to your clinical team and ask, they might know some good people as well.
Okay, thank you.
Yeah, great, Danny. Yes, reach out to the ALS Association or to your clinic team directly. And I want to go on to some of the other folks with their hands raised, but while you were talking, Danny brought up balance, and there was someone in one of our chats who was asking about core strength when you're spending most of your time in a chair or a wheelchair. Do you have some thoughts about that?
Yes, so is the question, can you do core exercises?
What would they be? What would the core
Oh.
exercises be?
I mean,
If you're,
so I'm trying to, I'll think of
I-
some off the bat, and Claire, you can add some, but
Sure.
even kind of shifting and doing, if you have that
Yeah.
ability to lean forward and come back up, side to side.
Mhm.
If you feel comfortable scooting away from the back of your chair a little bit without risking a fall, then you don't have the back support and that's challenging your balance just to sit upright like that.
Mhm.
Claire, do you have?
Yeah, this is gonna sound really silly, but you'll experience it when working with PTs. Is sometimes we just say, if you are seated unsupported, if that's possible, and even potentially doing something with your arms, think about holding your belly button in. It just kind of recruits a lot of the abdominal muscles to try and serve as a girdle, if you will, for the lower trunk. So think about kind of holding some things secure if possible. That's not always possible, but if possible. And then just gentle shifts in a seated position can sometimes recruit some of the core muscles.
great, thank you. And we may not get to every question because we have so many, but there's some great conversation in the chat for people who are wondering about, is yoga good? Is massage good? And people are sharing some ideas. So thank you for that. Tamara, would you help the other Dan and ask his question, please? We just need Dan to be unmuted. There we go, Dan.
Can you hear me now?
Mhm.
Yes, thanks for your patience.
Of course. Thank you for your good seminar. I've talked to several ALS patients and read some where people say the time they took a hard fall was when their brain told their leg to move and it didn't move. My question is, does it catch you by surprise completely, or what kind of feelings lead up to a time when you're at greater risk of let's say your knee not supporting you as you're going up and down the stairs, or simply walking? Like if I catch my toe on the floor or rug, it's harder to catch myself. Are there any telltale symptoms that you're in greater danger of having a fall because of how your legs feel?
Yes, several ideas come to mind, and Katie chime in. I mean, some folks have told us if there's early stages of weakness in the legs, sometimes they say they feel heavy. Sometimes they say, I can hear a foot slap. Sometimes I've heard folks say it's just a little bit harder to lift them. So that's certainly the body's way of saying something's going on. I try and tell folks, and it sounds ever so basic, but I think it can be helpful. Number one, of course, get that message to your team, because sometimes it can be a simple addition to make you a little bit more secure. It can be an ankle foot orthosis like an AFO. It might be a cane. It might be a walking stick. It might be a walker. But also, if we just think about how we do things, I think we as human beings have a tendency to do 5 things at once. I'm going to hold this in my arm while I reach it into my pocket to get my keys as I'm crossing this rough area. So sometimes just simplifying a task to where you're not multitasking and you can kind of focus on what you're doing, maybe not necessarily carrying something, paying attention to what's coming up when it comes time to turn, sort of doing it incrementally, not how we move naturally, but sometimes just simplifying the task can just make us safer, is what comes to my mind.
Good, thank you.
Great, thanks for your question, Dan. And let's see if we can get Javier on as well, Tamara. He's been waiting to ask his question. Hi, Javier. We're not hearing you. I know that I saw that Javier, okay. Javier was putting in the chat earlier how grateful he was for this conversation. So thank you for sharing your feedback. Lots more questions, and I know we're right at the top of the hour. I know you ladies told me you could stay for a few minutes because you're not rushing right into something. I wonder if we can do kind of a speed round for people who are able to stay. Your opinion of wheelchair aerobics? How do you feel about that?
I'm probably gonna put that in the category of sit and be fit, kind of and I'm not certain if that's what the questioner was going for, but if you're seated in a wheelchair, but you can still do some trunk activities or some arm activities, love it.
Great.
Love it.
Let's see. I have ALS with bulbar onset. I have continued with my normal physical activities, including golf. Awesome. Should I be increasing my exercise or continue with my levels pre-ALS?
I think if you are tolerating your levels and enjoying your life, you don't need to force more in. If you have any pain in your joints or any balance issues, or if you feel like you're missing one of those 5 components, then you can talk with your team to see if it makes sense to add anything else. But I don't think it's absolutely necessary to add if you're quite active already.
If it's
You know,
working. Go
If I
ahead.
could give a shout out real quickly for adaptive sports. It's amazing what's happened in the world of adaptive sports over like the past 10 or 15 years. We've had some folks get adult tricycles, and we've had folks use modified golf clubs. We've had some folks do rowing, skiing. So sometimes just Googling adaptive X, you'll see an amazing amount of resources.
Nice. And I know at least here in the Northeast, some of the states have some really great programs. So look into those. Always keeping your clinic team and in the discussion, right?
Yeah.
This is a really great question. What's the relationship between exercise and spasticity? What is the danger of increasing spasticity with exercise?
That is a great question. I think in my experience, spasticity for the most part likes movement. Not necessarily quick movement, but spasticity does like movement. So I've heard from many of our patients who have more spasticity that they really do better with shorter sessions of the stretching because it is only temporary, but it can help with it. Some of them will actually opt to do more active range of motion and not necessarily hold the positions and just kind of do repetitions up and down to loosen up. Unfortunately, with the spasticity, it will come back. Any of the benefit you get from the stretching does go away. And so doing those stretches or range of motion exercises throughout the day tends to work better. I also hear from a lot of them that the stationary bike can be useful, and a lot of them love getting in the pool. Had a few people tell me that they feel normal again in the pool. So if you feel safe in there, so it definitely, I think it can actually help with managing. Exercise won't get rid of the increased spasticity, but it can help to manage the spasticity. I trying to think if anyone has given stories of when it's worse, and if so, I think that'd be your body telling you that you're doing too much, and maybe there's some soreness now with your spasticity, and that would make it very difficult to move. So,
Claire, you were nodding. I didn't know if you wanted to weigh in.
Just completely agreeing with Katie.
Okay.
I want to just add, Lauren put a comment in there about choosept.com, find a PT. That is a great resource for finding, you can put in neurology and find a neuro specialist PT. It's not a complete list, but it is a good starting point if you're looking for a neurotherapist in your area. I also think clinics keep a list, so I would start there. But
Great. There, so we talked a little bit about spasticity. There were questions about muscle cramps as well, and if there were some good exercises or stretches or that you would recommend for cramping.
the cramping is tough. I've
Yeah.
definitely had some people tell me that the exercises, even stretching, can make the cramping worse. And then we're working with them to see if we can find different positions that don't make the cramps worse.
I think also working with the team to see if there might be a medication to go hand in hand with, kind of your activity routine. As Katie mentioned, spasticity and sometimes cramping is, the tone in the muscle. We all have tone in our muscles, but spasticity is the tone is really firing off hard and fast. So anything relaxing and rhythmical and gently stretching to kind of send a message to those muscle fibers and actually ultimately the nervous system of just calm down a little bit, I think can be helpful. So like the stationary bike, the gentle stretching. I sometimes tell folks, if it works into your routine, if you can stretch a little bit before bedtime, sometimes it makes for a better night's sleep. It sort of sends the body that message right before bedtime of let's just calm down a little bit if possible.
Great. And I lost the note that I had, but I think it was Kathy who said she is a PT, and she's living with ALS, and her clinic was a little bit surprised by her reporting that she was using the treadmill and those sorts of things. So she was very happy to hear your perspective, ladies. So thank you. Thank you for the info. Very hopeful and positive. Can you send this to all clinics of excellence?
Lori, I see one more question that was based on
yeah.
something else I said earlier about if you're receiving Qalsody, does this affect my exercise program? And that's based off of my comment of we might be moving toward rehab. And this really depends on you. We have some people on Qalsody who have been very, very, very stable for many, many, many years. And then a lot of people are still progressing on Qalsody. And so I think depending on what your presentation is and how your progression has been, it's another good question. I don't think our guidelines would necessarily change. We definitely still want it to be a safe program that you're tolerating. And I think if there is some gain in strength, that would be fantastic. We don't expect it at this point. But it is something that we are starting to look at on the research side. And we're not doing the study, but there is one study looking to see if we can do more. But right now, I think our recommendations would still be consistent with everything that we're recommending now. But it's something to, I guess, be hopeful for, that we're getting closer to rehab.
And hopefully people saw my note in the chat. Somebody was asking, what is Qalsody? And it's a treatment for people living with ALS who have been found to have the SOD1 gene. So it's not a treatment that's available to all, but probably genetic counselors would like me to push, get your talk about whether testing makes sense for you, so you know what your treatment options could be for sure. Ladies, I think we have to wrap it up there. You've already given us more time, and we couldn't be more grateful. Clearly, folks would love to hear from you again. And thankfully, I have your email addresses, so maybe we can do this again.
Thank you.
I mean, you guys have just been wonderful in helping us, but helping the ALS community in general. So I want to just say thanks again on behalf of everybody who's joined us today. And I also want to thank those of you who have taken more than an hour out of your afternoon today. Do give us some feedback both on how you learned about this webinar and what you thought of the webinar. It's a really quick survey that is going to be sent to you as soon as you sign off today. Also wanted to remind folks that between now and next month's webinar is ALS Nexus, the 3-day ALS conference, which will be available online, free of charge to families impacted by ALS. So I'm sure you have plenty of information on that in your inbox, but reach out if you need additional info. Next month, we have Emily coming from the Patient Advocacy Foundation. People are forever asking questions on Medicare Advantage. Is there a way to change if I'm not getting what I need? And so Emily will come and spend some time helping us understand what your rights are around getting Medicare and Medicare Advantage to pay for approved treatments. So join us next month. And before you head out for the rest of your day, please complete our survey. And again, Claire, Katie, thank you for all that you do.
Thanks so much.
Thank you.
Have a great day, everybody.
Bye.